I'm going to talk about the basics of Medicare and the things that you need to do when you're getting started. So if you're about ready to become eligible for Medicare and you've done no research up to this point, this is a great place to start. So stay tuned. Okay, let's talk about Medicare Basics. And this is a great place to start if you're brand new looking at Medicare and you don't really have any idea on the choices that you have to make or the things that you need to do to get started. So this is going to be a great place to start. I'm going to give you a very broad overview on Medicare and how it functions and some of the things that you need to do. I'm Keith Armbrecht. I'm founder of Medicare on Video, and I help people across the country with their Medicare choices. And I'd certainly appreciate it if you allow me to help you with your Medicare choice. There's no cost to use my service, and we simply make sure we get all our pieces in the right places. So I'm going to show you some of the things in the beginning that you need to understand about Medicare. And let's first start about coming into Medicare. And there's generally three ways to come into Medicare. First one would be Medicare disability. So if you're under age 65 and you have a disability and you've been on Social Security disability for 2 years, you may now become eligible for Medicare. And that's a great thing. So you need to understand your choices and how it functions. Now, I personally don't do Medicare disability, but I absolutely want to help. So I've created a website. If you go to MedicareDisabilityHelp.com, fill out the form. I will make sure that somebody contacts you to give you the choices available in your area and explain those choices. So certainly very important to understand that. Now, the main way that most people come into Medicare is when they turn age 65. So if you are turning 65 and you've worked your entire life and you're going to retire and you're going to go into Medicare, that's generally the way most people come into Medicare. And there's some things you need to do when you're about to turn 65. Now, the other way would be if you're working and you're past age 65. So you're not ready to retire. You may be 68, you may be 70, you may be 78, and you're still working. You're on a group plan, and you're not ready to come into Medicare. So there are absolutely things you need to do, and there are also things that you want to make sure you do not do, especially if you're going to work past age 65. So we're going to go through that pretty easily so that you understand exactly whatever scenario you may be in. Now, the best part about this, all of these solutions, generally when you come into Medicare, you're generally going to get more and pay less. So it's actually very good coverage, and it's also very affordable. So it depends on your specific situation. Obviously, if you're still at work and your employer pays 80, 90, or 100% of your premium, then you're going to pay more when you come into Medicare. But the benefits are generally always better than any individual plan or certainly any group plan, and I'll go through a little bit of that as well. So that's a good start coming into Medicare. I often tell people it's too good. It really is too good. So it's a great thing to have. It works fantastic, and it's a nice thing to kind of retire into. So let's start with turning 65. If you are about to turn 65 and you're going to come into Medicare, it's pretty simple. There's a chart that gives you a window to sign up for Medicare. Now, I'm almost going to tell you to disregard this chart. So you want to do it before your 65th birthday, before the month of your 65th birthday. So Medicare will start, if you're going to do it at 65, it's going to start on the first of the month of your 65th birthday, unless you're born on the first of the month. If you're born on the first of the month, it's going to start the previous month. So you absolutely need to do it ahead of time if you're born on the first of the month. But here, let's talk about June 15th. So if you're born on June 15th, your Medicare is going to start on June 1st. So you absolutely need to set this up ahead of June 1st. And it's really a good idea to do it 60 days out, 90 days out. Just get it off your plate. It doesn't make any sense to wait. Nothing's going to get better by the time your birthday month comes around. So here, if we're in June, we want to be doing this in March or April for June 1st effective date. Even if you're born on June 28th, it's going to be June 1st effective date. So it's pretty easy to do. First thing you need to do is you need to activate your Medicare Part B. So if you can generally do it online, and I've created a URL to make it easy. If you go to www.startpartb.com, it's going to take you right to the page on the Social Security website to start your Medicare Part B for June 1st in this scenario. So if you're born in the middle of the month of June, everything's going to start on June 1st. So pretty easy to understand. This shows months after your birthday. Believe me, it's complicated if you wait till after you're 65 to try and start your Medicare. It just doesn't make any sense whatsoever. So now let's talk about, we're past age 65 and we're still working. That's perfectly okay. And the way Medicare works with after 65 and still working is if you have credible coverage, so real health insurance at work, you can keep it as long as you're at work. So as long as you're still actively employed, you can keep your credible health insurance at work and not come into Medicare until you retire. So let's assume you're going to retire at 68. We'll make it easy for you so you don't have to work any longer than age 68. You want to do this well ahead of time. It takes a little bit longer to get everything through the process, and there's not that much. But one thing you absolutely need if you continue to work is you need an employer coverage form that your employer has to fill out for you to give to Medicare so that you will not have a penalty on your Medicare Part B. So you need to get your HR department to fill out this form and get it back to you and submit it when you activate your Medicare Part B. Now, you can get this form right on my website on MedicareOnVideo.com. It's in the Resource Center. I'm also going to put a link to it below this video, so you can just click on it, download the form. That way you can email it to your HR department. Depending upon who's working in your HR department, depends how long it's going to take to get it back. So do it well ahead of time. I would be doing it 6 months ahead of time. If I knew I'm going to retire in June, I'm doing this in January. If I know I'm going to retire in October, I'm doing it in April or May. And just have it done, get it off your plate, makes it easy to do. Now let's talk about the pieces of Medicare and figure out how you're going to choose the things you're going to need to have to choose. So Medicare has 4 main parts, and they're completely different from each other. So you need to understand, but it's really not that complicated. It's only these 4 pieces, but they did jumble it together like they would normally do to make it more complicated. So let's try and understand it real quick. Part A is hospital coverage. So Medicare Part A covers you when you're inpatient in the hospital. So things that go on in the hospital. Medicare Part B is outpatient coverage, things that happen outside the hospital, doctor's visits, outpatient surgeries, rehab, things of that nature outside of the hospital falls under Medicare Part B. Now, here's where they kind of confuse it for everybody and jumble it all together. Medicare Part C is Medicare Advantage, which is a completely different piece of Medicare than A and B. So that's one of your main choices, and I'll show you that in just a minute on which avenue you're going to take. And then the final piece is D, which is Medicare drug plan. So at least it makes a little bit of sense. D for drug plans kind of makes it easy. So you're going to have, when you first come into Medicare, you're going to have one big choice. And that one big choice is which avenue you're going to take. You're either going to stay on original Medicare or you're going to choose to go into a Medicare Advantage plan. And there is a major difference between these 2 choices. So very important for you to understand both of them. And I can tell you both can work, and it depends on your scenario. There are people perfectly happy on both sides, but there are also people unhappy on sides. So you got to make sure you know what you're doing when you make this choice. So pretty easy to understand. Original Medicare keeps you in Medicare and gives you kind of the freedom and flexibility to choose any doctor, any hospital in the country that accepts Medicare. So you can go to any hospital that you want. If you want to go Mayo Clinic, you can go to Mayo Clinic. If you want to go to Duke University, you can go to Duke University. And as long as they take Medicare, you can choose anywhere you want to go. You don't have any direction from Medicare on how to access your health care. On Medicare Advantage, it's a bit different. It's more of an HMO type environment or a PPO type environment where you have in-network benefits, where you have to go to certain doctors and certain hospitals and be approved to do that. So you want to make absolutely sure that you understand. I can tell you, if you're planning on traveling, Medicare Advantage can be problematic because you have that specific network that is generally in your local area on where you live. So it's a personal choice, and you just need to kind of understand it so that you make the right choice, and that way you don't have any regrets down the road. So, and full disclosure, I do not offer Medicare Advantage plans. I choose not to offer Medicare Advantage plans just simply because I personally would always choose the freedom and flexibility. God forbid something crazy comes along. I want to go anywhere I want to go. And there's really not a cost deterrent to choose original Medicare, and I'll show you that in a minute as well on kind of the average cost on how things work. So back to our chart. So really, your choices would be, if you stay on original Medicare, you're pretty much going to have A and B. You're likely going to add a Medicare supplement, and you're likely going to add a drug plan. So you're going to have A, B, a supplement, and a drug plan. And for the most part, across the country, all of that combined is generally less than $300 a month. So it depends on where you live. Some is much less than others, but generally it's less than $300 for fantastic coverage. It's almost 100% coverage. It's a very small deductible, and especially if you have a Plan G, you're only going to have a very small deductible with no copays, no coinsurance, super easy to use. So again, it's a very good program, and it's almost too good. Your other choice would be Medicare Advantage, Medicare Part C. And some Medicare Advantage plans can have zero premium. So you're still going to pay your Part B premium, but generally, and not necessarily generally, but a lot of Medicare Advantage plans have zero premium. Some have higher premiums. And it absolutely can be a get what you pay for scenario. If it's a low cost on the outside, it's probably going to be a higher cost on the inside, meaning when you use it, it's going to have higher out-of-pocket costs, where on original Medicare, super low out-of-pocket costs. So again, it depends on what you choose and how you choose it, and you'll have people give you all sorts of opinions on what they have, and it's the best. But just understand your choices. So it's really original Medicare, A, B, a supplement, D, or Medicare Advantage, Part C. And again, I'm happy to help you figure all that out, and that's what I do for a living, and there's no cost to use my services. If you stay on original Medicare and you get a supplement, whatever insurance company that offers that supplement pays me some to be your service agent. So there's no cost to you whatsoever to make sure that we get it right. So we absolutely want to get it right. So that gives you kind of an overview of Medicare, and there's certainly a lot more details, and I have over 100 videos, and you're certainly welcome to visit my YouTube channel, look at things specifically, best supplement plans, best drug plans, all that kind of stuff. But this is a great starting point. So if you visit MedicareOnVideo.com, you can get a quote on a Medicare supplement plan. You can find some videos there. You can also get to my YouTube channel there. The Resource Center has a tremendous amount of information. I'm going to give you some more information on my website right now, so I hope you'll stick around and let me show you things that you can find on the website, because there's a lot of information there. And again, I'd appreciate it if you allow me to help. And if there's anything I can do, I'm happy to do it. And I hope you have a fantastic day.